Welcome, everyone. We're so glad you're here. Today's session is all about empowering you with the tools and insights to make your claims cleaner, faster, and more profitable. We'll break down the terminology, walk through real world scenarios, share practical tips you can apply right away. So settle in, grab your coffee, and let's dive into the world of medical billing where precision meets payoff. If there's one thing that you take home from this whole presentation, is that we are always aiming for a clean claim. A clean claim is like a beautiful snowing morning with the sun shining in a peaceful, quiet atmosphere. Attention to detail is everything, and it'll keep you from the avalanche that is denials, delays, reworking your claim. You don't want to get a denial and then you start snowballing. You have to try and call the insurance. You're on hold, everything. If you submit that clean claim, it is there, it's paid, you can move on instead of having to take time away from your clients, your patients to rework that denial. Okay, so on this slide, we're going to be going over your billing terminology basics, the provider related terminology. We have your national provider identifier, that's your NPI, that's the unique 10-digit identification number for healthcare providers mandated by the HIPAA for use in standard healthcare transactions. Then we also have your PTAN, which is your provider transaction access number. And this is a unique provider number is provided by Medicare after contracting credentialing is completed with their Medicare contractor. Then you have out of network, OON. This refers to a provider that is not contracted, not credentialed with a health insurance plan. And then you have a third party administrator, TPA, a person or independent entity who manages benefits, claims, administration for a self insured company or group. So this slide is everything that's related to you as a clinician and your practice. And then going forward, we're going to be going over your software related terminology. And that is your revenue cycle management or your RCM. That's the financial process used in healthcare to complete billing, reporting, payment collections from insurance payers and or patients. We have accounts receivable, which is AR. You'll hear this a lot in the billing world. It's the outstanding monies owed to an organization. We also have your electronic health record. That's EHR. It's a digital version of a patient's medical history used by multiple care providers and healthcare organizations. We also have the EMR, electronic medical record. That's the digital version of a patient's medical history for one single provider. Practice management software, that's your PMS, that's your Ensora product that you use on a daily basis. That is the software used in a healthcare provider's office for appointment, scheduling, and billing purposes. And then we also have electronic data interchange, EDI, the electronic sharing of patient and business documents between healthcare providers and organizations. Now we move on to claim related terminology. So we have your International Classification of Diseases or your ICD-10s. That's the 10th revision of the International Classification of Diseases, uses 3 to 7 digits, includes additional digits to allow more available codes. More of a breakdown of the actual code itself. Current procedural terminology, CPT. I don't think I've ever heard it called current procedural terminology, so you'll always hear us refer to it as CPT. You'll always see it as CPT in the system as well. A set of standardized codes used by healthcare professionals to report medical services and or procedures. And then we have your DOS or date of service, and that's the date services were performed. We have your POS, which is your place of service, and that's your 2-digit code provided on a medical claim that defines where services were provided. And then lastly, we have your medical record, your MR. That's your documentation of a patient's medical history for a single provider. And now finally, we're going to move on payments related terminology. We have your remittance advice or RA, a document submitted by the insurance company with information on claims. This advice gives explanations for rejected or denied claims, also referred to as explanation of benefits. We also have your ERA, so that's your electronic remittance advice. This is an electronic version of the EOB. It gives details of insurance claim payments and is designed to comply with HIPAA standards. We also have your EOB, or explanation of benefits. That's a documentation provided by insurance companies sent to patients and providers summarizing costs involved, payment amounts, and financial responsibility. We also have your EFT, electronic funds transfer, and that's an electronic method of transmitting money, a paperless system of debiting or crediting amount into the account. So this is the payments that you're getting from the insurance into your bank account. All right, so here we're going to talk about some terms you'll come across that go hand in hand and cover the difference between them. First up, we have payer and payee. So the payer is the party making the payment, and the payee is the party receiving the payment. So you as the clinician, and the payer is the insurance company. Then we have primary insurance and secondary insurance. So the primary insurance is the client's or patient's first insurance that is to be billed. Usually it's their own policy. Secondary insurance is usually a spouse or someone who has insurance as well, and they cannot be the primary insurance. So then we have rejections and denials. So rejections usually happens at the clearinghouse level. So once the claim gets sent to the clearinghouse, if it doesn't pass all of its checks, it gets rejected by there and sent back. A denial happens after the insurance actually processes the claim and deems it not payable. Then we have the NPI 1 and NPI 2. So the NPI 1 is the individual NPI for the provider or clinician. And then NPI 2 is the group practice NPI. And then we have CPT codes and modifiers in place of service. So the CPT codes is, you've seen this on the claim first. So that's the service you render and provider. And then the modifiers in place of service is the additional information that goes along with the claim. Now let's talk about your major players. So this is where we get to see our terminology in action. The first major player is you. So you get the claim ready to go. You see your patient, you do your progress notes, you make sure everything is set up correctly. You have your CPT code, place of service modifier if needed, and then you get the claim ready to go. And then you go ahead and send it out to the insurance. So it gets sent to the clearinghouse. So essentially, it is like a post office. You take your letter or your claim to the post office or clearinghouse, and they distribute it to where it needs to go, the different insurances there. And then once the insurance gets it, they process it, hopefully as a payment if we have a clean claim, or a denial, and then you take it from there. So a day in the life of a claim. So the claim is created. Like I said in the previous slide, you create a claim with a combination of documentation and records of service provided. And this can be through kept appointments, your progress notes, or invoices. Then the claim enters an internal waiting status before getting sent out to the clearinghouse. Then the claim is submitted. If the claim is rejected by the clearinghouse, it is returned to you. If corrections need to be made, the claim will need to be resubmitted. If the claim is accepted by the clearinghouse, it is sent to insurance for processing, and you will be notified. And then they go ahead and process the claim. Once the claim has been sent to the insurance, you'll be notified through ERA whether it was denied or paid. If you do not have an ERA integrated with your Ensora platform, you won't be notified of the payment electronically, but you can possibly get paper checks and EOBs through that way, or you can go out to the insurance portals to check claim status on those submitted claims. So once you get that ERA, it's going to show paid, which is awesome. Way to go. You got a clean claim. You did everything right. You got all the pieces in there that you needed, and you just got a payment. It's awesome. So the next steps are, if there is patient responsibility, you will need to collect their copay, coinsurance, or deductible, and then continue with business as usual. Now, if you get a denied claim, there are many reasons a claim can be denied. Provider not in network, diagnosis code, not eligible on data service, place of service. So what are your next steps? You're going to submit a corrected claim. You're going to fix the error that's on the claim and then submit it with the original claim number and your resubmission code. If it denied for something like timely filing, you're going to submit an appeal for that. If you did submit the claim within that timely filing limit. So who does what from here? This process can be handled from pending to paid through billing team in your office, or we can help. Claim submissions, rejection, payment processing can be handled by an RCM and SORA team. This stuff can be simple or it can get really complicated. And when it gets really complicated, you don't always have time for that. And if that can be handled by a team other than yours, then you get more time with your patients. You get freedom from the tedious tasks. And you get to work with us because we are here to take those frustrating tasks off your plate. I just recently worked with a customer who said she finally had her weekends back with her family because she was able to not work claims on the weekend. We handled that for her. So she was able to do the patient stuff during the week and then family time on the weekend. So it is an investment, this is an added cost, but it does have strong added value. The service would be more than your typical EHR software package. We get to share in the successes of your company as well. Insurance billing correctly makes you money. We do offer two different packages for different size practices as well, as you can see. But whether or not you're working with a team like Ensora RCM team who will run checks and work to resolve issues, it's always important to keep in mind some common mistakes you can avoid to set yourself up for success. So let's go over some of these mistakes that are easy to make and some things that I see a lot. So starting with some coding mismatches. Okay, so first up, we have your POS errors or place of service. So if the place of service on your appointment does not match the claim or the services provided, it could likely be rejected by the clearinghouse or insurance. So say you have an office visit, but you bill it with a telehealth place of service such as 0, 2, or 10, it can deny. And then we also have diagnosis errors. So if the diagnosis on your claim is not descriptive enough, the claim can be rejected by the clearinghouse or denied by the insurance. So one of the mistakes that I see a lot is having a basic diagnosis codes, such as F4310, and then the insurance come back and says it needs further division. So you would just need either a point 11 or point 12 added to that diagnosis code. And then also, if you require prior authorizations for any of your claims, it has to match the prior authorization diagnosis code with the claim. Modifier errors. If the modifier noted in your claim do not match the provider or the place of service, your claim can be rejected as well. So for telehealth claims, a lot of insurances require that extra modifier on the claim to indicate that it is a telehealth, and that is a GT or 95. Or some insurances require education modifiers such as an AJ or HN. There are also other mismatches that can cause issues. Insurance verification. This is a very important piece to do before you bill out the insurance. You want to verify active coverage to see the benefits cover the services that you're providing. You want to make sure that you're in network and the client is active on the data service. And also you want to make sure to confirm the payer ID so it matches the insurance that you're billing. Another one that I see a lot is provider mismatch. Again, this is another important one. You want to confirm that you're billing with the correct rendering provider who is in network with the insurance, and then ensure that your EHR is set up to pull the correct provider's NPI. So what that means is not all providers are able to bill claims to insurance, such as interns, and would need a supervisor to be listed on the claim. When you've done all you can, you've sent your claim, you've checked it all, but you're still having issues getting the insurance to pay, here are some resources to help you. First off, we have excellent self-service educational materials on our Experience Hub. These are your Knowledge Hub articles, some courses to walk you through your billing scenarios. They can be really helpful for quick troubleshooting, but we are also a call or email away. Now, who you will reach out to will depend on whether you are contracted with the RCM team or not. If you have the RCM team, you have a personal representative assigned to your practice. If not, you can always contact the customer support for claims help. And I just want to say, this stuff is hard to learn. We hope this session gives you clarity and confidence in navigating the essentials of billing. Remember, accuracy and consistency are key, so stick with it. Our support and education teams are always here to guide you. As you continue exploring and working in Ensora, you'll likely have more questions, and that's perfectly normal. To help you along the way, I'd love to share a few of the go-to Knowledge Hub articles I find helpful. We will go ahead and drop those links in the chat now, so be sure to save them for easy access later. Now, we can move forward to a live question and answer session.